have any, do we have any committee reports that we want to share a highlight of before we get started?
Donna and I do not.
Okay. Judith, you want to give us an update on in-person? Hey, Judith, are you there?
I am here. Yes, I sent in a deposit to have an in-person meeting at at Bar Louie on June, I believe it's June the 3rd. And so we have to figure out details, but that will be our first in-person in a long time. So I'm really excited, and our speaker will be Fred Tsao from ICIRR. So we can talk about it at the executive committee meeting, but you know, let's plan something really good and get a lot of people there. So anyway, that's an update.
Yep, you got it. Okay. Anybody else? You help people, you have nothing going. Okay, nothing to update us
Yeah.
on.
Well, we've been, so this is Jane, sorry.
No, that's
So,
okay.
you know, we have been meeting and we are tracking, very, you know, sort of actively, tracking what's going on with the police accountability, and we'll be coming back with a report, but, so I don't have anything specific now, but I do invite, anyone, who wants to join the committee to email me, or Dee. And so I'm Jane Ramsey 27@gmail.com. And you know, we'd welcome you. So we will be reporting some updates, but not for tonight.
Okay, and where is Dee? Is she back in Chicago or is she still in Florida?
No, oh no, she had an accident. She's okay, but she was um badly, she broke her shin bone, which is supposed to be, I guess, amongst the most painful breaks you can have. So it was kind of sudden, and she's recuperating, and she should be home. She's hoping to be home soon, but that was a setback for her.
I guess, man, I thought I had it was number one and hurting myself, but that sounds like it's worse than what I did.
Well, we won't ask you guys to compete, and we want you both to stop.
Okay.
And Carol as well. Carol Bean.
Yes.
Jane, put your email in the chat for people
Yeah.
who don't have it.
Okay,
And
I will.
speaking of Carol, has anybody heard about Carol and our Walk for Peace or whatever it's called?
Yes, I've talked to her a little bit, and we're meeting
Yeah.
tomorrow. Oh, can you hear me okay?
Yeah.
Okay, I've talked to Carol a little bit. We're meeting tomorrow morning for a call and to talk about some promotion ideas, but we're planning to get out, you know, a newsletter. She recently got the link for folks to start registering. So that's now on our website, and we'll be discussing if we want to, you know, what social media will look like, communications, all of that tomorrow.
Do I need to sign up again, or am I considered signed up already, Kat?
Let me check. I haven't.
Because I'm going to be one of the walkers, and I need
Okay.
whatever paperwork I need to start collecting money.
Okay, yeah, let me check and see if we have you on the list. We'll see.
And so what we're talking about, for those who are not at our board meeting, there is an organization, and help me, Betty, what's the name of the organization?
Strides for Peace. STRIDES.
All right, Stride for Peace. And it is a opportunity for people to walk or run, or probably scooter, or whichever way you want to get around, to raise funds for, this is an anti-violence thing, anti-gun violence operation. Yeah. And so we decided that, you know, CWTA should do that, but, you know, we have to get people to sign on to be a walker or runner or whichever, and get other people recruited to join. I mean, I'm sure a lot of us have been a part of these walking and running things as fundraisers before. So what's the date? Kat, is June 6th? Is that right?
Yes.
June
Yes.
6th. Oh, Carol, there you
can
are.
also do a virtual walk. Like you don't, like I'm going to be out of town, but I'll do a virtual
And-
link to people to raise money.
Yeah, you can raise money and not even walk. And so there are many ways to participate. We're working on getting information out. We will have it out within the next couple days. And it's very simple, and it's a 2-mile walk. So it's not like you're walking forever, and you'll be among friends. And it's in the evening, so it should be a really lovely thing by the lake. And I suggest you come with us.
Okay. All right. So we will look forward to you and Kat getting us something to do to sign up, sign on, however we get committed to doing this. So thank you. Anything else to update? Because I'm anxious to hear Jaquie. Anything else? I don't want to cut anybody off. Nothing else? Okay. So Jaquie Algee, and you know I love everybody named Jaquie. So she started off on top just by her mommy naming her. But Jaquie also is one heck of an organizer. She and also a political strategist. So you know she's one of those people that has a lot of skills that we all benefit from. So she is at SEIU, which is what we wanted her mainly to talk about tonight, because you know as we're looking at healthcare, particularly healthcare for women, it's a really important issue. But also in this political atmosphere we're in, we always have to make sure that we know enough. So as we're talking to people, as we come up on this next election day, that we know what's happening and how to speak to people about the issues that they care about. And so, you know, if you care about making sure you not only have health care, but you also have what do you call it? Jobs, not affordable jobs. What do you call it? Just jobs, jobs with good wages. There's a phrase for that, I'm sure, that I'm blocking on. But you know,
unfair wage.
there you go. But Jaquie and SEIU are really expert in making sure that they talk to powerful people to give people what they need and want in the workforce. So healthcare, workforce, political activity. Jaquie organized women's march here in Chicago, and she continues to keep us up to date and informed about that. So, you know, she's a political organizer as well as a union organizer. So I don't know, I probably could talk about 16 other things that Jaquie is good at, but know that we have the pleasure of hearing from someone who has many skills, all of which fit right into our women's agenda. So Jaquie, I'm gonna let you talk and I'm gonna shut up.
Well, Jaquie, you don't have to shut up, but I would never dare not ever say to you, shut up. Now, I might ask you, Jaquie, could you let me have the floor for a minute, but I would never, ever, ever, because my regard and respect for you is just, yeah, you're just up there at the top of the list. You know, you have done amazing things. All of these, most of the women on here, you know, with the exception of some of the younger ones, and they have even done a lot to hang their hats on. So, you know, that's why this group came together, you know, because it was amazing women doing some amazing things to support justice in all forms. So anyway, CWTA, I feel like, you know, I'm part of CWTA now. I need to pay my dues and do something. I don't know what I need to do, but I've always felt very close to you. And, you know, there was a time pre-pandemic when I used to attend your meetings, whether I was, you know, speaking or being, you know, it was just like we're women who are out here trying to make things happen. And so I wanted to be with you. And so for all of those reasons, I thank you very much for allowing me and asking me to speak to you tonight on some of the things, some really good news. It's good to share some good news, isn't it? And victories that we've had for home care providers and workers in this last year or so, but in particular in this year. So let's just start. I'm just a firm believer. You don't really understand where you are or where you're trying to go if you don't know where you came from, right? So I'm gonna give you just a little history. Tell me how much time do I have, Jaquie? Because I don't want to dominate things and I don't want to bore anyone, but I want to make sure I get enough good information, hopefully, to you.
Oh my goodness, see, I'm busy chatting and I've had myself muted. No, you can have a half hour and then we'll do Q&A.
Oh, that'd be great. Okay, great. So let me give you a brief history on organizing home care workers in the state of Illinois, which I'm really, really proud of. I mean, it's not just because that's a union that I work for, but we have been trailblazers for the country in terms of home care services and providing services and workers. We've been the model, and I'm really proud to say that. So I don't know if you all know, some do, and perhaps many don't. What is known as or is SEIU Healthcare, Illinois, Indiana, Kansas, and Missouri was formerly 3 separate unions, right? And the 3 of them were Local 4, which organized nursing home workers, Local 20, which organized hospital workers, and then it was Local 880, and we organized childcare and home care workers. Now, I tell the story in different places and to different audiences and groups. But one thing that is consistent is to be real clear on who we're talking about. These were thousands of women, most of them Black and some other nationalities, primarily Latinx or Hispanic, whichever you prefer. And then there were also Caucasian sisters as well. But the point being, predominantly women who took care of people. And, that's what we do, right? We do it in our families, we do it in our communities, we do it in our churches, our workplace, wherever we are, we usually are the people that take care of others, right? But guess what? And this is the part that I get choked up on. These women were making $1 per hour to do some of the things. And you think about, yeah, I see you, Jerry, you like that. No, you got to be kidding. To think about some of the stuff that they had to do, like bathing and cooking and cleaning and putting diapers on or washing clothes and cleaning their homes. I mean, the list is so long, and it's determined when they do assessments, when the state does assessments, exactly what needs people need, right? Or services they need. But the point being, I'll go back to what they were making, $1 per hour. And I'll tell you something, when we started organizing them and they started going down to Springfield to testify before committees, there usually wasn't a dry eye in the House. The legislators could not believe that these women, proud women, glad to be doing this work, thankful to be doing this work, wouldn't stop doing this work. No matter if you did offer them more, they were going to do it because they felt it was their service and their duty. And so this started in 1984 is when 880 started organizing them. And it wasn't until I think we got their first raise was under Governor Edgar. And, you know, it was just, you know, pennies really considering. And to be where we are today and what they've managed to be able to win in terms of their contract negotiations, another time, not a dry eye in the house. I'm telling you, people like our president, Greg Kelly, and other men, in addition to women, when we were going through the negotiations here these last several months and negotiating the contracts and things were just really looking better and getting better, people were just crying because they couldn't believe that they were getting some of the things that a lot of workers, quite frankly, take for granted, like paid time off, like increase in salaries, like vacation, like the possibility of having pension. And you have women who not only were struggling to, you know, they were doing this work every day, but they had to, you know, it wasn't such that you could take off to take care of your mother or your father or your sister, your brother, your child, right? Without not being paid. Now you could take off, but you wouldn't be paid. So all of these things are really just something to just not only hang your hat on, but just be so proud that we've gotten to this point. Although it's a shame that it took these many years to make it happen. So anyway, somebody is supposed to Kate.
Yes. Yep.
Yes, dear. Could you're gonna share, give me sharing ability?
Yes.
Co-hosting or
You are a co-host, so let me know if
okay.
you're able to share.
All right, let's see. So I want to start showing you that I downloaded all of this stuff. You all just bear with me, please. Let me start reading some of this to you, and then I'll show it to you on the screen because I really want you to see it. So we started several years ago, actually before the pandemic, really working on this contract because we knew the contract negotiations were coming up. And keep in mind, you know, nobody was meeting in person, but we were still getting it done. They were meeting like we're doing right now. Zoom became their best friends. and that's another thing that, you know, we take pride in, that these women of all ages, in particular, more seasoned women, learned how to work their way around a Zoom. It was amazing. But guess what? Because they did, they were able to really put this campaign together. Because, you know, I don't know if you know this, but SEIU, and that's one of the primary reasons that I accepted a position with SEIU, because it was the only union that I had ever heard of that was member-led. Seriously, and it wasn't like somebody just saying something to get a little kudos or, you know, or a pat on the back. Truly member-led. And so these women formed their bargaining committees. And I mean, and we're talking about during the pandemic, they formed bargaining committees and they met with each other, you know, separately. And keep in mind that home care providers are pretty much independent workers, right? They're entrepreneurs in their own right because they don't go to a workplace and meet every day to go somewhere else. They have their own clients and they meet and they go and take care of them based upon the need, right? But they were making time to put this campaign together because they knew they were determined to win this contract. I should be letting somebody in. That's Margaret. I can let her in. Okay. So once the pandemic was over, we've had several, we started doing, we're known, I think some of you might know this, but we're really known for our lobby day experiences, right? I mean, we take bus loads down to Springfield, we take over the Capitol, we just, do our thing, right? But we couldn't do that again post-pandemic. They weren't letting us come down like that. So we started doing, they said, well, we got to be able to talk to them some kind of way, right? And we got to be able to get in their faces. So we started doing what we call mini lobby days. And so with that, it might be 3 workers from around the state that would meet up down in Springfield, or 5 workers, but the message was still getting across and it was being heard. And legislators, again, were sitting back, taken aback by the fact of no, they're not making $1 an hour anymore, but what they're making is still not enough. It's not enough for them to take care of their families, to take care of themselves, and to be, thriving in a sense of, their communities. And how dare we don't do something about it, so then we started getting legislative support, and that was a good thing because you got agencies who are gonna kind of fight us back on who gets the dollar, right? But then we had legislative support, and a lot of that was not only coming from those workers and the committee that went to them and said, this is what we want and this is what we demand. But we had a whole community that came out and started supporting them as well, And so those were some of the things that we did in the last couple of years that helped to keep the fire burning, And then this year, we were able to start doing our big lobby days, and we had a big one in March, and that was right before the contract was settled. And oh man, we showed up. I'm telling you, there's bus loads that came down to Springfield, and we had our champions and supporters and sponsors in the legislature that came and stood with us in the rotunda and spoke out and in support of these women. And I'm still going to say women, but I will say this because I know we have one man on here. I see. I will say this, that this, like other industries, are changing. There are men who are joining this workforce as well to help take care of people, whether it be a family member or someone that they don't know. So let me see. I can get this up for you. I want to show you. One other way I could do this if I'm having difficulty, Kat, is send them to you.
Yeah, if I can share it, if you
okay,
I'll
send it to you right now. Mm-hmm.
Sounds good.
I'm having a little challenge here. We don't want to go into that. Okay, let's see. Hold on just a second. You all bear with me. Okay. Okay. And oops. Okay. Okay, I just sent the summary to you. Okay, and then I'm gonna send you, and we'll walk through the summary for a minute, and then these other pieces, they're like fact sheets and some of the mailers that we sent out that I'd like to share with you as well. But I really want us to kind of talk through this summary.
Okay.
Did
I
you get
just got
it?
it. Mhm.
Okay,
Let me
great.
pull this
Thank
up and share it with you all. 1 second.
Thank you. You all are quiet. Y'all note takers like I am. I'm a note taker. I'm hoping. And if it's something that you need, please don't hesitate to ask. And if I need to get it back to you later after this meeting, I'll do that as well. All right. So major contract highlights for the collective bargaining agreement between SEIU HCIIMK and Department on Human Services and the Office of Rehabilitation Services. So if you can see, do we need to enlarge it? You all shake your head, because I know for me, I could have it enlarged. Okay. Hey, that better, Jackie? I see you shaking your head too. I can see it better now, but so, okay, so the term of the contract was July 1st, 2023 through June 30th, 2027. Wages for personal assistance. And if you can see, as of this January, they had an increase of 50 cents. So they are making $17.75. I'm gonna tell you, I just can't state it enough how people felt. You know, it's like you're being recognized for your work. You're being recognized for your worth. You're being recognized for something that you see as a service, but you know, some of these workers have clients who have no one else but them. They're their point of contact. That's who they see every day. That's who helps to take care of them. And they take pride in that. They really, really do. All right, so January 2025, it's going up to 1825. So each year, as you see, with the exception of 2026 and 2027, there are 50-cent increases. And then those 2 years, it'll be 75-cent increases. Wages for maintenance home health providers. The rate increase goes into effect, and it did on January 1. It said and/or approval, but it did. And so CNAs, as you can see, certified nurses, nursing assistants, and you see how well. And so I want to talk a little bit about the training, you know, that's offered through our training center, our Helen Miller Educational Center. Helen Miller was our first board president, and you talking about an amazing woman. Oh my Lord. She carried God on her shoulder. And when she went down to Springfield, baby, she dealt with all those legislators in a way that they had no other recourse but to say yes to her. So of course we named our center after her, but we do training there. And that was part of this contract agreement too, to get training there. So people, if you know, so yeah, people take pride in their work. They should take pride in their work, but they might not want to be a home care provider all of their lives or all of their experience in this profession. They might want to go on and become a CNA or LPN or RN, and people do. They have. And so you can see the rates of increase per year for them. Then the seniority for individual providers effective July 1st, 2025, or upon federal approval, whichever is later. Individual providers or personal assistants and maintenance home health care workers reaching seniority milestones indicated below will receive a rate add-on corresponding with the seniority milestone. So you can see how that is. So, you know, they accrue the hours, and then their hourly rates are based upon that accruement. And you can see some examples down here. So, paid time off. So again, remember I said, you know, there was a time when they didn't have paid time off. They just had to take off and take care of their business, whatever that was, without pay. But now, they you know, will go from accruing 16 hours of paid sick time per year, and after the first 2 years, accruing up to 40 hours. Treat them like the humans they are, right? That's what I felt. Jane, you know how I was feeling about that, right? Treat me like, you know, you got to treat these women like they're the humans they are. So example of carryover and cap, PAs earn 15 hours of personal time off in 2024. And they, pardon me, can carry over 9 unused hours. Retirement. They never thought about it. They just felt like, okay, when I retire, just retire, you know. Hence, we got women who have 40 and 45 and 50 years doing this work because they can't afford to retire, right? Well, that shouldn't be either. You know, at the point of retirement, some of them need to have a home care provider for themselves because they've just worn themselves out. So this is a wonderful thing, I think, you know, and that's still in the working, as you can see. Training and support. So remember, I mentioned the Helen Miller Education Training Center, and so we more than doubled the investment in training by $10 billion. You want something, Marianne? Marianne? Oh, okay, thank you, dear. So we got $10 million in the final contract for training. So again, you always, first of all, you want your workforce to be trained, educated, informed, and also have access to advanced training if they so choose to do some other profession within the home care industry. And so that's what we're doing with that. As of July 2024, we have new provider orientation for new hires, mandatory training for current IPs, and some of this stuff, we had some semblance of it before, but they cut it out again because of the pandemic, and they weren't rushing to get it back, but our committee insisted on them getting it back because it was just that important to them. The registry, the state has agreed to implement a system that connects IPs to consumers individual providers rather, who need a caregiver and vice versa by December 31st. Overtime, improved the overtime policy to make it less punitive for individual providers, and improved submission of timesheets, are now able to hand in their timesheets via email. So we went through a period, and I'm trying to remember where they got this from. I don't think it was from the state of Illinois. It was someplace else, another state that was testing out, you know, different ways to do time documentation. So they had us call everybody in, and we had to do the training, and they had to have this call-in system on their phones. I'm sorry, on their client's phone, so that they could make sure that you were at their client's house and wasn't nobody just signing your timesheet kind of thing. And so now they have it where they can do their timesheets via email or fax, which is good. And I'll tell you why. Because I know personally of situations where either the client was on the phone taking care of some business when they came in. So it might have been another 20 minutes or hour before the person, the worker could call in and report that they were there. Well, for the department or the agency, they're going to just track it and pay you for the time that you called in. But that doesn't mean that's when you started, you know? So if they could get their clients to sign off on their timesheets like they were doing before, and then they could email them or fax them in, is a good thing. And or walk them into the door's office in person. Important contact information for IPs and spousal providers will be permitted to enroll and serve as individual providers. And so if you had your husband and or wife who needed home care services, and you could provide it, maybe you've been providing it, but you didn't know you could get paid for it. And that's, I can tell you countless of stories of people that have been doing that and didn't know that they could qualify to be paid for it. And so that's something else that's available now through this contract. So I'll pause here. And then I'll show you those. Let me send those to you too. Okay, just a minute.
So does anyone have any questions while get a new visual up?
Any question?
Hi, Jackie, this is Phyllis
Jerry?
Wilson.
Oh, well, Tina first and then Jerry.
Okay.
Go ahead, Tina.
Hey, Tina, how you doing?
Hi,
Hi.
very, very good. Thank you very much for your service to our humanity.
Oh.
I just want to hear what you're doing around their retirement. I started a little nonprofit for teachers, Chicago public school teachers, to protect our defined benefit. Do you understand when I use the term defined benefit? Pension. It's a guaranteed pension or a defined contribution, which is a 401k plan. Can you talk a little bit about what plan around the retirement you got going on for them?
Yeah, so I cannot talk a lot about that. I know that they're working on it, Tina. I know that's part of the contract agreement to do. And I'm looking on here to see. Let's see. We secured a path to retirement that could put 25 cents per hour of every hour worked by an individual provider into a retirement fund in the final year of the contract. So the final year of the contract is 2027. And the state will pay for consultant costs as part of the initial phase. Both the state and the union shall meet during the course of this agreement to work together on designing the plan. So that's as much as I know. But if there's specific questions that you have, I'd be happy to find the answers out for you, and or connect you with someone in that division who could answer them better than I can.
Please, thank you very much. I appreciate that.
No, you're welcome.
And keep on keeping on.
Thank you.
All right, Jerry.
Hi, Jackie. Nice to see you again.
It's good to see you too.
I have two questions that are very different. One is, what kind of health benefits do these workers get? That's one, because I know very often healthcare workers don't get good healthcare benefits. So that's one question. The other one is very different, so maybe I should let you answer that one first, and then the other one's totally different topic. So,
okay. So that's a great question, Jerry. And so some years ago, not very long, but I guess, let's see, we've been in that building. It's 2008. So I want to say about 2010, maybe before that, though, now that I think about it. We get contracted for a health fund, and that health fund manages healthcare benefits for our members. And they, home care providers can opt to be in that health fund. And in some cases, if they're married or have some other form of health care funding or plan, then they choose not to, but most do. And that healthcare fund is located in our building at 22nd and Halsted. They have half a floor and they stay pretty busy, you know, trying to make sure that our members get the support they need, questions answered, and most importantly, their coverages provided. So I hope that answered your question, Chair.
So it's like an insurance, they're acting like an
Exactly.
insurance. Okay, I
Mhm.
got that since I worked with one. The other question is very different, and you know, there's federal, there's a federal, I think it's a executive order, actually. It's coming out of an agency about minimal staffing in nursing homes. And you probably know that, and people here should know that there's like this whole move in nursing homes with private equity firms. I mean, they're just wringing out the bucks and not taking care of people. And so the feds, you know, have said this is minimum requirement. So I'm curious, and again, so this is a very different topic, but what's the unions doing about that situation? Both private equity firms getting involved in nursing homes, and then also, you know, I mean, in general, I'd expect, but I don't assume that the union is supporting minimal staffing because it's less work on folks. That's also more members, so I'm just curious about that side of it too.
Yeah, so, and another good question, hey, and you, as you would guess, we're really fighting that because here's something that, you know, any of us who have gone to a nursing home to visit someone, a loved one or something, you know, someone we know, might encounter, you know, I'll say a slight in caring, you know, as you could observe, right? But if you know about the staffing for that particular facility, you'd understand. If you walk into a nursing home and you're a nursing home worker and they give you your load for the day, you might get 8 to 10 to 15 patients to take care, residents rather, to take care of within an 8-hour period that have all kinds of needs. And you can't, it's just impossible for you to do. You know, now there's some people that might kind of slough off anyway. Of course, people are human, that happens, right? But for the most part, again, this is service work. People don't just do this just to do it. And as you can tell, it ain't like they're making no, you know, super mega bucks, right? They obviously do it because they care. But yet you still cannot adequately take care of that many people, you know. So staffing it's important in nursing homes and hospital settings, even with home care as it relates to the number of people who have requested home care services because they want to remain in their homes, live independent, don't want to go to a nursing home. But they do, you know, the home care providers have a shortage as well. So staffing is something that we are really pressing on. In fact, that's one of the reasons we're going to Springfield on the 15th of May. That's a little plug. I want to get that flyer to you all so you can see it. And if you want to join us, please too. But staffing is so important, and we're fighting the owners about it. We're fighting the state to say, hey, you know, you all got to be in support of this. You got to be in support of safe staffing. I don't care which industry it is, but certainly for nursing homes, because more than likely those residents are the neediest, right? And I know I have a woman who used to sing in the choir at our church, but she also used to work with me at HCII, and she's in a nursing home now, and I go to see her after church on Sundays, and it just breaks your heart. Because, you know, and yet I know I'm looking at the staffing. You see 2 or 3 people running around there trying to take care of all of these people, and they got, you know, from feeding tubes to bags to they need to be changed. They just need care, you know, and it's impossible. It's impossible. And shame on those nursing home owners who don't feel like they should pay people right. And that's part of the reason they're losing some of their staffing, because they don't pay good. And that's a fight that we're in with them all the time. Like, you got to do better about paying people. This makes no sense.
Is there a way to oppose these private equity firms being involved in?
There is, but you know, there's also, you have to be cautious and careful about who you're opposing. It's like knowing who you're in bed with, you know, you just, yeah, there is a way. And I know that our division director and our research director have been working to find out ways that, you know, they can help our members to really fight about it and be able to speak on those equity firms coming in.
Jaquie, we got 2 hands up, and I want to.
Okay, all right.
Before we run out of time.
Okay, Jaquie, I'm sorry. Okay.
No, you're fine. I mean, it's all very interesting. I mean, go ahead, Phyllis.
All right. You see, this is something I'm very passionate about. Okay, who is next?
Jackie, it is such a pleasure to meet you. And Jerry, you asked exactly the right questions. This has been my life since 1972. And I know the whole history that you were talking about from the Department on Aging perspective, which you did not mention, but they've been very involved also. And of course, the huge home care staff that they have the responsibility for paying through the community care program. So I've watched all the iterations of finally getting some money in there for insurance protection to start with, and then moving on toward leave and all of that stuff. But I just, my hat's off to SEIU. They did a great report for Illinois Department on Aging on developing a pipeline for bringing people into home care, starting in actually upper levels of grade school and into high school, and building that in. And there are issues with the Department of Education in terms of classification, which SEIU uncovered. And I mean, this is a huge issue. And I mean, for all of us who have not yet had experience with nursing homes, eventually you will, and you're going to want them staffed properly and staffed by people who are adequately paid. And the nursing home lobby is extraordinarily strong in Illinois in particular. So my hat is off to you, Jaquie, and thank you so much for coming to us to expose some of these issues. And Jerry, you are so right. This issue of private equity getting into these businesses, including hospice care as well as home care. Yikes. We've got a lot of work ahead of us, and SEIU is out there right there. So Jaquie, bravo.
Thank you.
Jaquie, it sounds like you have somebody just as passionate.
No, right? That's great. We should all be, because you know what, I'm gonna tell you. But by his grace, you know, I don't need it right now, but you never, ever, ever know. And I've had loved ones and have some now that are receiving nursing home care and home care. And and I want to make sure that they're treated right, you know, but I also understand why they might not be. And that's where the fight comes in. Mary, my sister, what's up?
Mhm.
You're on mute, babe.
Unmute yourself, Mary.
Okay. All right, Jaquie. It's so good to see
All right. It's good to see you too, babe.
So I want to congratulate SEIU too. I mean, you were one of the strongest unions at county, after the nurses, of course. But
Of course.
you all also organized the doctors there, which is
That's right.
great. Emily, right.
That's right. That's right.
So my question though is not about that. I'm just
Okay.
wondering, what is the relationship that is now, or you all at SEIU would like it to be, the relationship between the home care providers and Medicare and Medicaid? Are they getting reimbursed now, or do you see that in the future? Because that certainly is a sustainability issue, you know, for the future. So what do you see going forward?
And so your question is Medicare and Medicaid for the providers?
For for the home care,
For the home
the
care.
independent providers, right?
Right.
Not the nurses or the CNAs, because that's a
Right.
different
Right.
issue.
Right.
But the people who come in and, you know, do the laundry for somebody, get them out of bed, get them dressed, make them a little lunch, those people, the ones you were talking about.
And you know what, Mary, now you know me well enough to know I'm not going to tell you anything that I don't know. I can't do that. But what I will do is find out for you, because I don't know the answer to that. But I'll find out and let you know.
Okay, okay.
Yeah,
But in your own mind, Jaquie, I mean, I would think, you know, the more that healthcare providers can get reimbursed through Medicare or have some sort of relationship with Medicare and Medicaid, the more sustainable those positions will be in the long run.
Oh
So,
yeah,
okay.
absolutely. It just makes
Yeah,
sense,
please,
right?
please
I'm
get
putting
back
it
to
down,
me on
babe.
that,
I'm putting it
okay?
down. I'll try and get you an
All
answer
right.
by tomorrow, if not tonight. I bug people. They don't
Thank
want to, you know, some people are
Thank
off at 5. What's being off at 5? Who gets off at 5?
Thank you.
I know you don't, Jaquie.
No, I don't. Okay. So, Kat, would you mind just showing those 3? And if you don't show them all, just, you know, I want them to see at least those mailers that we sent out.
Yeah, I can share those. Let's see.
Thank you. And any other quick
Who did they go
questions?
to? Who did the mailers go to?
So the mailers went to the people throughout the state. Throughout the state, we sent mailers to members, to their communities, to voters in those areas, you know. So we you know, checked out our van, and between our membership list and the van, which lists eligible voters, because keep in mind, all this is political. At some point, it comes back to politics and who you got in office to be able to move this stuff, right? So we sent mailers out, and sometimes some people got multiple mailers. Don't send me anything. I got it, but you know, it was good to be able to share the victory too. So, and you see this one here is contact information if people wanted to find out more, because you do have workers out there that are not working for agencies, and so they're independent, and if they want more information, you know, we don't close our door to anybody. We're trying to organize everyone, because that's the way it should be. Not just the organizing part of it, but just making sure that people are paid right, they're respected in their workplace, and the services that they provide are adequate and equitable for all people, no matter who they are, right? Yeah. So I just cannot thank you all enough. This 30 minutes or whatever just went by so quickly. But and this young lady here, Rakia, she's amazing. She's a healthcare provider, but she also just got ordained a couple weeks ago.
Oh,
So
wow.
yeah, she's an amazing. Yeah. So, and that's the thing too. These people that work in these industries are still people too. They don't just work to take care of somebody else. They got lives. And they do a number of things that really help to contribute to the community, to be a part of the community. And that's what you want, right? You want people to again feel like they're being cared about and cared for so that they can do better about caring for others.
So where's the $20 an hour campaign?
That's the one that we're going down to Springfield on the 15th about.
Oh, okay. Okay.
Mhm. And oh, wait a minute. Speaking of which, hold on. That's what I gotta send you. I want y'all to. So we don't have to hook because I know people gotta go. But can I send the flyer to you? Okay, wait a minute.
Yeah, absolutely. And
And
we'll
then
send a follow-up email as
send it
well.
out to everyone. If you want to go, I would love to have you come on my bus, but you go. We got buses leaving from all over the state, so and my bus is gonna leave from 318 South Troop, and then come to our church at Trinity, and we'll leave, get on the highway from me. So that's on the 15th. And we go down, we have a great time. We do the rally. We got elected officials who are like, whoa, y'all got a lot of people that really care about this. Yes, we do, because it's not just workers that are going. We got retirees, we got seniors that, are getting home care provider care, if you would. And then we got community partners that are going as well. So I had a young man call me today. He said, Monica, I got about 20, how many? No, he asked me how many CNAs could he have on the bus? I said, I don't know, maybe what, 20? He said, oh, shoot. Like that was nothing. So I'm like, okay. So, and so we go down, we do that, we have the rally, and some people lobby if they can. And then we go to Golden Corral and we have a wonderful lunch, and then we get on the bus and come back, and it doesn't cost you anything but a little time out of your life, your day, so, for a good cause.
And what time do you leave?
We leave, so the bus at 318 South Troop will be boarding at 5:30. It'll leave there at 6 in the morning. And then it'll leave Trinity at 7.
Okay. All right. Any more that we can ask Jaquie about before she has to leave?
Just want to thank you, Jaquie. Just what you do, your just passion, your compassion, and leadership is, we're just grateful.
Oh, thank you.
For you.
Thank you, darling. Well, you know what? I'm grateful to be a part of this. I mean, some of you I've told this before, but I truly believe this is my purpose, God's purpose for my life. So it's not work for me. It really isn't. It's just, it's something I'm just very passionate about, and want to make sure that I do my part,
Jaquie,
Ask one quick question.
Yes, ma'am.
Yeah, Jaquie, I have an appointment on the 15th. If I can cancel it, how late can I let you know if I can do the bus?
Baby, now who we talking about, bitch? Now
Well, I don't want to be last minute, but I want to go.
You already know. If you tell me that you think you might want to go, we gonna make.
Well, I'll put me down. 318 South Troop.
Okay, good. Yeah. That's a senior building. It's
Okay.
called Academy Square. Cat, I just sent you. Is it Cat or Kate?
Cat.
Cat.
Cat,
Okay.
yes.
Thank you, sweetie. I just sent that to you. You can just show the flyer if you see it, please.
Okay.
But that's a senior building. It's called Academy Square. And the building coordinator told me that, whatever time you get there, the guard can let you in. You can sit in their community room. If the bus is there, then you just get on the bus. But if the bus isn't there, you say you got there at 5, some people do, then you could sit in their community room, have use of their restroom facilities and so forth. And so, yeah. All I need to know is that you are, so I can give her your name.
Jaquie, I really want to say I'm coming, but May 15th is my birthday and my family will kill me if I'm not here. So, but I want to know whenever you tackle, these equity people,
You want to join that fight?
Yeah, because I know you have the workers in hand, but those equity folks, I mean, those are the bastards that really are worth fighting. So that's the part of the fight I'm interested in.
That's right, honey. Thank you. Thank you. Kat, do you see the
Yes, let me share this one too.
Okay. Yeah, so I'll make sure that all of you, I'll let you know, Jaquie, and then you can let everybody else know about that, as it, go. Yeah, there we go. Get on the bus.
Back to Springfield.
Back to Springfield. Yeah. Reserve your seat. You call me. That's my phone number, my cell number. So feel free to call me. Some of you have my number already. If you don't, take it and call me if you decide you want to go, or anybody else that might want to go. So yeah. Spread the word. I want to fill my bus.
You can put it out on social media.
Yeah, we can share this.
Okay, yay! All right. Well, listen, I just cannot thank you all enough. Jaquie, I want to talk to you offline about how we can collaborate a little more and better than, more.
You can call me anytime, Jaquie.
Yes, ma'am. Okay, I'll do that. And some things I'm thinking about on that. So thank you all so much.
Now, if you folks don't know, my saying that, call me anytime, is I can get a call anytime. So I want you to know how willing I am to work with Jaquie. Am I lying, Cleopatra?
Very true. Very true.
Well, I'm gonna just tell you, you all look so great, and so many of you all are my sisters in the movement. We have been, and we've fought for years, and we're gonna just keep on fighting till we win.
There you go. That's right. No one ever told us how to say stop.
No.
So we ain't stopping. But anyway, thank you, Jaquie, very much. I learned a lot, and I'm sure other folks learned a lot as well. When you say $1 an hour, I did swallow my stomach, but this is, I mean, I knew that there were problems in the healthcare industry, home healthcare industry, but I did not know it was that bad. Awareness is our best antidote for bringing things into light. People just need to know, and that's why I was interested in where the flyers are going, that you're educating the community as you fight these battles.
Yes, ma'am. And let me just, in closing, let me share with you all, when Jaquie asked me to address you today, she said, what do you want to talk about? And I said to her, and the Spirit just brought me this title, the benefits of staying in the fight to win. These are some of the benefits. We're going to stay in this fight until we win.
You got it.
All right.
Okay. So
love y'all. You take care. Stay safe out there, please.
Hope we see you at Bar Louie, Jaquie.
Okay. All right.
Yep, we're ready for the next one.
All right. Okay.
There'll always be a next one.
No, There will. You're
Yep.
absolutely
There you
right.
go.
Okay. Bye-bye.
Bye.